December the 8th, 2023. And welcome all of you. I can't tell who is on the screen right now, so let's start. If there are board members, we need to know if we have a quorum. So if you could identify yourselves, press unmute so that you can speak to us, please. All I hear is silence. Is there any board member out there that I'm not aware of?
I see Sep as online, but
Steph is online.
yeah, it shows that he's in this meeting.
Anyone else that's a board member? Well, I don't think that we have any decisions that have to be made, but in order to have a valid meeting, we need to have a quorum. So I think that what we will do is we will go through the agenda and make sure that all the information is captured, and that way we can send it out to the board members. Is that okay? I'm talking to the person who's keeping the records of this.
Yes.
Okay, then we'll go ahead and we'll start with our new health director and the mission and vision as she sees it here in Cochise County.
Thank you, Supervisor English, board, and members. So I'm Barb Lang. I am the new director of Cochise County Health and Social Services, and I have been here exactly 48 days. So still very new, really enjoying my position and consider it a privilege to have been chosen. So I just want to talk a little bit about some of the things that I'm interested in pursuing. And one of the biggest things as far as the mission is really making a positive difference in the lives of people in Cochise. And that is going to be my main focus. My vision is really to concentrate on the intersection of mental health, primary care, and justice services because I see them all as very entwined. I've been really concentrating a lot on making sure all of our health clinics are consistent, that there's flexibility. So no matter where a patient goes, whether they show up in Wilcox, whether they show up in Benson, Sierra Vista, Douglas, they're going to get the same services. So I've been working with the director of clinical services there on ensuring all the policies are updated, that they look the same for each clinic, and that we're really focusing on accessibility, that we're letting people know that we're here, we're trusted, and we're going to ensure that their information is confidential. That's a big, big piece. I was just talking to Supervisor English about mental health. I have a strong background in mental health and also integrated service. So some of the things I'm looking at is bringing people in that have lived experience to really connect with the patients that come into the clinic, as well as having some counseling that can take place at the clinic. Especially because we're seeing a lot of fentanyl and people struggling in Cochise County with substances. I want to make sure that I support those people so that if they're coming in for some sort of health issue, that they're also aware that they can have someone safe to talk to, that we're not having to refer everybody out. We can do that through telehealth service, and we're looking at different ways to fund that. But that's definitely going to be a large focus for me because whole health is so important. There really is no health without mental health, and we're doing a great job providing those primary care services, but I want to balance that out because a lot of medical issues are connected also to mental health issues and vice versa. So we want to make sure that when people come to us, they have that full whole health experience. So that's going to be some of the things that I'm looking at. I also want to focus on quality management. So we're going to start collecting data at all our clinics, and we're going to be posting that data on our clinic walls. How many people have we vaccinated? How many STI checks have we done? How many people have we serviced for sports physicals? Really getting that information out to the community and sharing how we're making continuous improvement. So one of the things we're going to be doing moving forward, once we have the data, is Myra, our Director of Clinical Services, is going to be presenting quality information at every meeting to talk about the data and how we're driving outcomes. So really, continuous improvement, whole health, and accessibility is going to be the focus. And how can we use that information to benefit our individual communities, because they're each unique. So collecting that population health data is really going to help us drive excellence. Does anybody have any questions for me?
I see Seth up there, and usually if people have questions, it's Seth. So,
Okay, well, I'm here. I'm ready.
Good morning, Seth.
Hey, good morning. I've been having a little internet difficulty here in Pomerene on the banks of the San Pedro, and I may have missed this in the beginning. Really great to meet you, Barbara. Looking forward to meeting you in real life soon and supporting your work and the work of Cochise County Health and Social Services. My name's Joseph Sepp Spritzma. I work for the Center for the Future of Arizona here in Cochise County, but was a probation officer for a long time and worked very closely with the health department. And then I also was with the University of Arizona on a public health project through a grant with the Legacy Foundation for several years called Building Healthy Communities, and just absolutely appreciate and support all the work that the health department does, and also got to participate and support the development of the strategic plan these last few months in meetings in Bisbee and online. And that is really my main question is, unless it's already been touched base on, next steps for the strategic plan, and have you had a chance to see the work that the amazing folks in your department have done on it? And do you have any input, ideas, what that will look like or how that will move forward?
Absolutely. Really, really good question. And I'm thrilled to hear that you are a part of that process. So I did take a look at it. And one of the things that I did is I linked each of the strategic initiatives to the Board of Supervisors initiatives so that we can be going the same direction. I'm a big consistency fan, so I want us all working towards the same goals. I also, because I thought 5 years, 5 years is such a long period of time and a lot can happen in that time, is I shortened it to 3 years because I thought 5 years was a little bit far down the road. So I'd like to take a look at it every 3 years, but I kept the spirit and the integrity of the document. I streamlined it a little bit to be a little bit easier to understand. I thought some of it was a bit highbrow, and I want to make sure that anybody that reads it online, no matter what their educational background, is going to understand it. So I streamlined it a little bit. I linked it up with the Board of Supervisor initiatives, and then I just made it a little bit more user-friendly because I thought there was some concepts in there that were a little bit hard to understand and didn't really sound super down to earth. So I made it a little bit more digestible. And so today, this afternoon, later, we're going to be meeting at a meeting to discuss that strategic plan and those revisions, and certainly I hope you have the opportunity to join us, but that's the next step.
Awesome, thank you. And it was an honor to participate and support that. And I think I was the only civilian there, and just kind of giving like a general public's perspective. And I just really was appreciative of being included in that, and glad to support any next steps as they move forward.
Thank you for that.
Well, thank you for that update and your questions, Seth. If no one else has any further questions, let's go on to the next agenda item. And that
Hello.
seems to be Dr. McLaughlin.
Hello, everybody. I hope you can hear me and see me all right.
Yes, we
And
can.
Ms. Rivera, are you ready? I'm going to hit share screen. We were joking about this and technology difficulties yesterday, so we have
Yes.
redundancy in place.
Let's try it out.
but I am going to share screen here. All right, are you able to see my presentation?
Yes.
Yes.
Outstanding, we did it. So I'm going to talk a little bit today. You may be hearing a lot about this in the news, and this is something that we are obviously very closely involved with at the Public Health Department. This is RSV. You know, you hear about in the popular media currently about the triple demics or the syndemics of COVID, influenza, and RSV kind of all hitting at the same time this winter. And there's been some wonderful advances in science with regard to an RSV vaccine that I wanted to discuss a little bit about and just kind of educate everyone about this particular virus. I think we've all got COVID education coming out of our ears, and we're pretty current on our influenza information. So I wanted to kind of drill a little bit deeper into this. RSV stands for respiratory syncytial virus. And we're going to dive a little bit deeper into this. This is a viral infection that infects the respiratory tract. The people that we mostly worry about, the vulnerable populations for this, are our extremes of age, our very young children, and our elderly patients. They are the ones who typically are the most badly affected. This is spread through respiratory secretions, droplets, uncovered coughs, things like that. And we're particularly worried about person-to-person contact in close congregate areas. Good examples of this are going to be daycares, hospitals, nursing homes, things like that. And you may remember from our COVID battle scars that we talk about how long viruses can survive on inanimate objects, such as tabletops or doorknobs, handrails. Unfortunately, RSV can stay for several hours, 3 to 4 typically, which means, you can touch it after someone previously has touched it, rub your eyes or your face, and you can now have a chance to get infected yourself. A little bit of a doctory geeky background about this is the RSV virus is an RNA virus from the Paramyxoviridae genus. And there are two main types, and that's going to be important when we talk about the vaccine. The two main types of RSV are A and B, very similar to influenza. And for those of you who are public health geeks like myself, this is a cousin to the human metapneumovirus, which has wreaked havoc for us in the past. So how do we prevent RSV? RSV is prevented by a lot of the basic tools we utilize in public health, which is hand hygiene, washing your hands with soap and water, not touching your face. Respiratory hygiene, covering your coughs and your sneezes, making sure that you're not wiping snotty noses, touching guardrails and banisters and doorknobs, and then having someone come behind you to touch it and then rub their eyes. Fortunately, I'm very excited to be able to say that this is now a vaccine mitigatable disease. And we have a new vaccine that we're going to talk about here in a moment, but that is targeting for adults aged 60 years and over, pregnant women in their 32nd to 36 weeks of gestation, all infants less than 12 months of age, and children up to 24 months of age at high risk for infection. There's also prevention that's previously been used with a medication called Synagis that we were doing monthly for premature infants or high-risk infants that had congenital heart defects, born with compromised immune systems, or bronchopulmonary dysplasia where their lungs didn't get a chance to develop appropriately due to being premature. Fortunately, we now have a better tool in our toolbox. So let's talk about how we treat RSV. Sadly, there is not a lot of treatment for RSV, so we're going to center on that public health maxim of prevention, prevention, prevention. Supportive care is the hallmark of treatment for RSV, and this is hydration, controlling the fevers with Tylenols or ibuprofens, and rest. All the things I like to say your mom probably told you when you were a kid. If you get sick, stay home, drink a lot of fluids, and rest. That's still good medicine. Severe infections require hospitalizations for oxygenation, and sometimes in very, very bad cases, mechanical ventilation, where we put them onto a ventilator, as we remember from the horrors of COVID. There are antiviral medications such as ribavirin, but they're sadly not very effective. So we're mainly focusing on prevention. And let's talk a little more about this. These awesome new RSV vaccines. I know this is a bit of an ugly slide, and I'm going to try and dissect it down so we just get the white meat and none of the fat here. Beyfortus is a new vaccine approved in August of 2023. This is targeting infants less than 12 months of age and has reduced RSV hospitalizations up to 80%. This is also utilized for children up to 24 months of age with severe complication risk from RSV. So again, your very premature infants, your infants with bad immune systems that are compromised, infants that may not heal as well as we would like, or those born with congenital heart or lung defects. Pfizer also has a bivalent vaccine. Remember, bivalent, two valents, because there's type A and type B of RSV, so it's targeting both of them. And this is called Abrysvo. This was approved in May of 2023, again, targeting pregnant women in their 32nd to 36th week of their gestation and adults 60 years and older. This is a single-dose vaccine, and the European Medicines Association has also approved this, so we're going to be seeing that data coming out in our European colleagues, as well as Canada and Japan have pending applications that I believe are going to be hitting for approval in the next week. Last on the offering is Arexvy, which is approved for adults 60 years and older to prevent RSV and has about an 82.5% efficacy against RSV. You may remember that nothing in medicine or health is 100% guaranteed, but these numbers are looking really solid. Anything above 80% we're very happy with. Anything above 90% starts to get into the range of those amazing vaccines that are tested and true for us, such as the MMR vaccine or hepatitis vaccines. So looking at these vaccine types, it's important to remember, how do we reduce severe disease with our RSV complication patients? Vaccines are now available. Again, these vaccines are targeting pregnant women, all infants less than 1 year of age, and higher risk children up to ages 2 years old. Patients over 60 are also important and targeted for vaccine this winter. The complications now. Access to the vaccines as of now, fall 2023, is difficult. These are coming through the state and getting distributed to larger geographic areas. I would be happy to wax philosophically about the problems we face with rural public health another time, but we are seeing the majority of these vaccines going to Maricopa and Pima counties, the motherships, and we have a scant amount coming down to the outlying counties such as Cochise. Based on this and the targets that we are looking to hit, again, pregnant women, infants less than 1 year of age, and children up to 2 with high-risk complications, birthing centers, getting those children as they are born, getting that vaccine into them before they leave the door. That's important. That's a target area for us. Pediatric offices to make that assessment of if this child is at high risk, are they appropriate for that vaccine? And local pharmacies for other populations are ideal vaccination sites. These are going to be the thrust of where we're hoping our population gets their vaccines from, and we are facilitating patient engagement and direction of traffic and flow to these vaccination sites that have been fortunate enough to receive that vaccine. My last slide is a series of references should you decide to dig a little deeper and get some more information for yourselves. Appreciate the chance to discuss this, and I'm happy to take any questions from the group. And thank you for the opportunity.
This is Ann English. I have a question that will be asked to me by the public is, well, they're used to some of these vaccines being paid for by the government. And so is this going to be something that's subsidized by the government, or do they have to have insurance? And do the insurance companies at this point in time recognize that for the populations you've mentioned? And I'm specifically talking about those over 60 because that's the people that will be asking me. The others won't.
Yes. Yes, so these are going to be subsidized, and these are also going to be covered by third-party payers. I actually just trotted my mom down to get her over 60 RSV vaccine, which was 100% covered as well. So recognizing the need for this push and this desire for protection, and this targeted group, yes, these are subsidized and these are reimbursed by vaccines. No, I shouldn't say reimbursed. These are covered by vaccines or by insurance. I'm sorry. Good question, ma'am.
Ann?
Yes.
Ann?
Yes, Lanny.
Yeah, I just want to let you know I couldn't get in on the Zoom, so I'm on the telephone. I clicked on everything that said join the meeting, but nothing worked. So I just thought I'd mention it in case there are other people out there had the same problem.
Well, Lanny, I'm so glad that you're at least able to hear what's going on, and I've asked Myra, I believe it is, to make sure that each one of the Board of Health members gets a complete copy of this, and so you may be able to look at it later and just listen now. So thank you, Lanny, for being online.
Good. Yeah, I would appreciate that, Ann. Thank you very much. And just to add on the RSV vaccine, I went into CVS and had no problem, no charge, no cost, anything.
Thank you. Well, pass the word on, Lanny.
Lenny, that's music to my ears, and thank you for that, sir, and I appreciate that endorsement. I feel like I owe you a coffee for saying that for me. Thank you, sir.
Okay.
We have
All right.
Sep with his hand up here with a question, I believe.
Yeah, thank you. Thank you for that update, Eric. That was very helpful. Just curious, back in the days of COVID, I thought the forward-facing dashboards were incredibly helpful to the public. Is there any, I know this is not quite that level of intensity, but any planned use of forward-facing dashboards or information like that getting out to the public so people can make just better decisions about what they're doing and where they're going and how to access vaccines and things like that?
That's an amazing question, and it's almost like you had a sneak shot at our next presentation, sir. Again, I appreciate the setup there. Yes, we are obviously tracking this data with a lot of scrutiny, and our wonderful epidemiologist, Dr. Daniel Williamson, will be speaking about this here shortly. But we are not sharing this information directly with the public. This is accessible, and we do facilitate ways that this can be accessed, but we are not pushing this out to the public. We are utilizing this in our Cochise County Health Alliance, our CCHA or CCHA, that we discuss about this with our, I call it an all-comers meeting, where we have all of our healthcare providers from the county log in, and we're able to give them snapshots by the week of disease activity on the communicable disease front. I would welcome opinions about this. You know, lessons learned from COVID are that, you know, we don't want to trade in fear mongering, but also I'm a data scientist. I like talking about data, and I like giving informed information. I would welcome suggestions and opinions about this, about do we want to push this out, because it's very simple for our team to do it. And I would welcome opinions from the group and the board on this, please.
Hi, this is Evelyn. I have a question for you.
Yes, ma'am.
I have an uncle who doesn't have a computer, and he lives in New Mexico. But I know that this is the case here because through COVID we had some circumstances like this. Is there help for people that they can call in a number and then you help them to get the vaccination? I just know that was an issue for my uncle in New Mexico, and I don't know what was here. So thank you.
Yeah, great question. And the short answer is yes. You can call our public health department. We are more than happy to direct and give resources to where you can go based on your zip code or your geographical region or catchment area of places where you can go to get your vaccine. This was an early decision we made about, I'm going to use the term directing traffic. Rather than being a vaccine distributor ourselves, we chose to be the front-facing engagement area to make sure that our people get the vaccines and help them understand where to go. And we can do this via digital engagement, online. We can do this via good old-fashioned phone calls. Shoot, we may even have carrier pigeons. But we want to make sure that everyone is able to know where the heck they can go to get this vaccine. So all they need to do is just call our public health department and we can give them routes. Great question. And most important thing is to not go unvaccinated coming into this season, please.
I have a question.
I have just to follow up on that. So so they're directed where to go,
Yes, ma'am.
but if they don't have computer or computer access, then is there somebody that can help them schedule an appointment?
So you can schedule at your local pharmacies or your local vaccine distributors just by calling. You can call them and say, I would like to come in at 1 p.m. for a vaccine, please. And most of the sites are walk-in capable. You may have a 10 or a 15-minute wait, but you will be able to receive your vaccine that day. That's actually how we did my family's. I hope that answered your question.
Thank you.
Can you
Yep,
tell me
thank
if
you.
people are experiencing any problems after they have the vaccine?
The great question. You know, most common problems after receiving, and I'm going to start broad and then go narrow, are with any vaccine. And this is the puncture in the skin. This is a tiny little needle, you know, about 24 gauge needle going into the body. So typically you're going to have maybe a little bit of redness or erythema, we call it, at the site of injection. You may have a little pain or soreness at the site of injection. And that usually lasts for about a day. Again, it's minimal. But I do want to make people aware of this in full transparency, and that is mainly just due to the needle going into the musculature. Now, specifically for RSV, vaccines are made to boost your immune system. We're not going to be giving someone a dose of the virus and build up their immunity that way. This isn't a live virus vaccine like chicken pox. So we're not going to make you sick. But what we are going to do is we're going to challenge your immune system to say, hey, I recognize this bad boy. This is the RSV vaccine. Let's make a team of white blood cells so that if we see it again, we're going to be able to neutralize it and kill that sucker. But what that does take is a little bit of fatigue on your body. So for a day or two after your vaccine, you may feel a little tired, a little run down. I would not expect any fevers, but you may feel 85 to 90% of your norm for a day or so while your body's immune system is building up those troops to go fight those viruses when you see them again. Great question, ma'am.
Thank you. I think it's important for people to be knowledgeable when they go in, and that the only things that they've noticed so far is what you have said, and sometimes it makes them feel better to know that you're tracking those kinds of things, so that if there were problems that they could look forward to or say, well, okay, but it'll cut. Full transparency never hurts.
100%. And I've always said, going back to days of COVID or even pre-COVID, trust. Public trust is the most important thing we trade upon in public health. And the only way to really get that is transparency. So my job is to lay out the science and the facts, and again, let people know what the heck they're getting into when they walk down there and roll up that sleeve and say, I want it right here, please. So that's my goal, and that was a wonderful question. Thank you for that, ma'am.
Well, public health should always be thought of as trying to keep people well. And somehow people don't get that message as often as we would like for them to. Sometimes they think of us as a place to make them well, but we like to think of it as we want to catch you before you get sick and help you not to be ill. So I'm hoping that over time we can do a better job, like you say, of letting the public health know why we're here. We're here to help you to stay well.
Yes, ma'am. I couldn't agree more. And that was like a mission statement right there. I love that. Thank you. Makes my heart sing.
Thank you. Are there any other questions, comments? Let's look like we're gaining board members, so we're getting the information out and they'll distribute it. So let's move on to the next agenda item.
Next, we have Tomini Allen, and then we'll have Daniel.
All right. Good morning, everybody. I'm going to share my screen following Dr. McLaughlin, which is perfect. I had to change my slides while he was talking because I thought this piggybacked really well. I'm going to talk about where we are with the 2023 and 24 influenza and COVID vaccines. I was going to start off with flu, but I'm going to go ahead and dive right into COVID only because we have some of the things. Up here, I have the numbers for Cochise County Health and Social Services and the number of vaccines we've administered since October 1st. Our numbers are very low, but we did have a very large change in how the vaccine was distributed once it was commercialized. The county health department is now only getting those federally funded vaccines as opposed to having all the vaccines in the world. Cochise County, though, our numbers are 7,929, which is very, very low per our population. However, it is right in range with what we were at last year with the bivalent booster. With that being said, we are doing the same thing that we're doing with the RSV vaccine. We are being a facilitator to the community of where they can get it. If they have health insurance, Medicare, or anything like that, they can call the health department and we'll direct them to the pharmacies and the providers in town that are administering the vaccine. We keep that list updated every week and try to get as much information out as we possibly can. Moving on to the flu, which is our big one that we do distribute. I love the CDC's campaign, and Barb sent it out to us the other day, and I've been kind of toying with it for a while too. I think it's one thing that we need to really focus on when we talk about flu, COVID, and RSV vaccines in general. They don't prevent it completely. They keep it from having severe symptoms. And I think being able to change our wording to the population, because we all hear the person that says, I get my flu vaccine and then I got sick the next week. We get it, but did you end up in the hospital? You know, were your symptoms as horrible as they could have been? So the CDC did wild to mild. And I love rhinoceroses and I love unicorns, so that's why we got this one. This will be our big push in December and January coming out for flu vaccines for Cochise County. With that being said, our numbers this year look really good. We're right in line with where we were last year. We've done 206 6-month-old to 18-year-old kids with vaccinations. Last year we were at 172. This BAFA number is adults 19 to 65 who have no health insurance at all. And we've done 53 compared to 35 last year. Our privately purchased vaccine, we've administered 302 doses. Last year we did 410. We did receive some of our state funding vaccines for children a lot earlier this year than we did last year. So that accounts for some of those numbers. The total number of flu vaccines in Cochise County from October 1st, 2023 to 5/2023 is very, very large. So we are doing really, really good with that. Most of the people getting vaccinated are over the age of 65. Slide down to my notes here really quick. The flu vaccine is available until June 30th, and we will push it till then. I know in Douglas, numerous times I was vaccinating kids on June 29th last year. So that's where we're at for flu and COVID. Does anybody have any questions?
I don't hear anyone or see anyone with hands up, so thank you.
All right.
We'll move on to the next presenter. Thank you for the information.
And next is Daniel Williamson.
Sure.
Daniel, are you with us?
Yep, I'm here. Okay. Is that visible to everyone?
Yes.
Yes.
Okay. I'm Daniel Williamson. I'm an epidemiologist with Cochise County Health. And I'll be going over our current data in Cochise County for COVID, flu, and RSV. We'll start with COVID. And again, these are for our MMWR week. This is week 48, which was last week, so all of last week. Where MMWRs are repeated or are reported a week behind, just so data has a chance to catch up. This graph is over the entire COVID-19 pandemic. The orange bars represent our cases, and the blue line represents COVID-like illness being presented. COVID-like illness is any kind of respiratory illness, flu-like symptoms, so it'll catch a lot of those influenza and RSV patients that are presenting with those symptoms. You can also see that I put on the appearance of the different variants as they came to light. And towards the right-hand side, you can see current data. We do have 4 variants that are kind of emerging. They're all strains of Omicron. EG, HK, FL, and HV are kind of dominating the United States right now. This graph is just over the last year. Again, orange bars represent our cases, but the blue line now represents our hospitalizations for COVID. And you can see most current data on the right-hand side of the screen is showing that we are trending upwards in both cases and hospitalizations. TGen in Flagstaff has been sequencing a lot of the COVID tests throughout the state and identifying what strain they belong to. And currently, we are seeing a lot of that HV and FL within the state. Those are those newer variants, as well as we do have some of the XBB variants that's a little bit older still circulating. Moving to flu and RSV. This is the epi curve for the entire state of Arizona. The orange bars represent our 5-year average, so this is what we would expect to see based on our previous data. The blue bars represent our current year's data. So you can see right out of the gate, flu season started in MMWR week 40. Our flu was already above what we would expect to see throughout the state, and it's maintained that throughout last week. The second bar graph, the purple and green, represent the different types of influenza. So we have type A and type B. Very predominantly type A right now, which is traditionally what we would expect to see early in the flu season. We'll see a lot of type A, and towards the end of the flu season, influenza type B will start to ramp up.
What's the difference between the two?
Between A and B, I might have to divert to Dr. McLaughlin for that.
Hello all, this is Eric. In short, chocolate and vanilla. We use this nomenclature to track different types, but these are different flavors with vastly the same type of symptoms. There is some belief that influenza B carries a little bit more pathogenicity. It makes you a little more sick than influenza A. We typically see more influenza A in our outbreaks, but it's very common to have both clades or types circulating at the same time. Clinically, for me, it doesn't make that much of a real big difference. It's more for the epi team to track what types we are seeing. Good question.
Thank you.
Thank you for chiming in there.
We have another question too, Dan. Okay,
Sure.
here we go. Yes, go ahead.
Oh, me?
Yes.
Okay, thank you. I was just wondering, back to the COVID, the various strains that you reported, are they all at some level covered in the bivalent vaccine that we have now? Yes, I see you, Doctor. Yeah.
Yeah, this is Eric. I'm happy to wade in there on that. Short answer is yes. So when we talk about these different strains, these strains all carry the same basic way it enters our cell. And that's with that very famous spike protein. It is literally like a little spike that the cell of the COVID virus comes up and stabs into our cell and then goes in through that portal. Our vaccines are made to work on the spike protein, which is the common denominator, if you will, for all types of COVID virus. I should say SARS-CoV-2. Let me say that. So these are different flavors, again, if you will, and strains. And fortunately, we're seeing these as being a lot less pathogenic for... They're not making us as sick as some of the other previous variants that we remember where the hospitalizations were horrific. Omicron, XBB1 and 2, these are making people ill, but not sick, ICU level, requiring those things that we saw earlier with, the the flavors, the variants we were seeing in 2021, late 2020. Those were much more severe, much more pathogenic.
Thank you.
Yes, ma'am.
Yeah, it seems as this is mutating, pathogenicity is increasing, but severity is decreasing. And that kind of tends to be the case with most viruses, which is to our benefit. So back to influenza. So I went over the state of Arizona. This is Cochise County specifically. Again, orange bars represent what we would expect to see based on our 5-year average, and blue bars is where we are at presently. You can see that we started the season a little bit high, but overall we've had some highs and lows compared to our 5-year average, but we're pretty much where we would expect to see our season. Again, with the flu type, we had 1 week where we had primarily influenza B, but you can see that influenza type A is dominant. Moving to RSV, this is for the entire state of Arizona. Orange bar is what we would expect to see. You can see that up until about 3 weeks ago, we were under what we would expect to see for RSV, and then 3 weeks ago, we've surpassed that, especially the past 2 weeks. So RSV season throughout the entire state is pretty high right now. The chart underneath shows what age groups are most affected, and you can see that children under the age of 4 are predominantly those that are being impacted by RSV. For Cochise County specifically, RSV, knock on wood, is actually quite a bit lower than what we would expect to see based on our 5-season average. We had a really slow start to 2 cases, so we went about 4 weeks without seeing anything, and then they did start to ramp up, but they do continue to be under our projected. Again, just like the state, the ages that are being impacted the most are those children under 4 years old. And I do send out most of this data weekly as an MMWR report. If you don't receive those and you would like to, you can either send me an email at dwilliamson@cochise.az.gov, or if you want to put your email into the chat, I can add you to those distribution lists. And I'm happy to take additional questions if you have them.
This is Lanny Cobb. I just want to make a comment. They are really great reports, and I will share them with, I live in Winter Haven, so I share them with the residents and other friends within the Sierra Vista community. So you're doing a good job with your reports.
Great. Thank you so much for that. I appreciate the feedback.
Any other questions or kudos for Dan? If not, thank you, and let's move on to the next presenter.
Hi, that's me. I'm just giving an update on the community health needs assessment. Oh, I think, Mo, you have your hand up? Oh, okay. I got a notification. There we go. With the community health needs assessment, so as we reported in the previous Board of Health meeting, we've contracted with Croy and Milligan and Associates for the 2023 to 2026 community health needs assessment. So the survey has been rolled out. It was created by LaCroix and Milligan, and it was reviewed internally by CCHSS as well as the CHA-CHIP steering committee. The survey rolled out officially on October 5th, and it was mailed out via postcards, and it was sent out to about 55,000 Cochise County residents. Through the survey collection efforts, there was focus groups in each of the quadrants, which were Wilcox, Douglas, Bisbee, and Benson. And then there was also in-person collection survey attempts, which included like food banks and things like that, just being out in the community, being out in the health departments and things like that. The survey officially closed on November 27th, and so far there's been a collection of inputting and everything like that up until 1,415 surveys collected. Currently, they're still just finalizing the last details of the report, and we're just getting final numbers, but that's our update for the community health needs assessment. Oh, I thought I was on camera. Sorry, guys. Any questions?
So when will you have this report out so that we can hear it or see it?
I think the expected time frame is this month. So by the end of this month, early January, they'll give it to us, and then we'll be able to distribute it amongst the community via social media, a PSA, just through Jane, obviously, to put it out in the community.
Thank you. Any questions? Comments?
The question, Alex, sounds awesome. Looking forward to seeing the data come out of that. I'm just curious, in the past, it seems like the health department has coordinated with like Benson Hospital, maybe Northern Cochise and Copper Queen, because they also have to do CHAWS. Is that still going on, or was that beneficial in the past?
So that was the attempt with this new round of the community health needs assessments, is to get on the same cycle. Through the CHIP steering committee, there were some, and I had to look back on my notes to identify which ones specifically, but that was the purpose of just aligning with, I believe, Copper Queen Hospital and Canyon Vista. I'm not too sure about Northern Cochise. Like I said, I'd have to check my notes, but that was the purpose.
So we're both Benson and Northern Cochise. We use the same firm at the same time to lower our expenses, and ours was published, not published for the public, but our draft was published for us to look at within the last few weeks. So it is kind of in the same cycle now, but we have to have them approved. I think for us, the federal law is that our CHNAs have to be approved in December, no later than the month of December, and then our implementation plans have to be approved no later than May. So we were on a bit of a deadline that had to happen, but we can certainly share it with you once it's final.
That'd be great.
Well, I think that's a worthy goal to help all the organizations that have to have this done. And so if it's a scheduling thing, then we need to work on that so that it can all be done at the same time if that's possible.
Agree.
Anything else? Any questions, comments? If not, thank you, and let's go on to the next presenter.
That was our last presenter. So I'll send out the invites for the Board of Health with the coming year, just like I did this past year. Just kind of have them on your calendars already for the 4 quarters coming in January.
I thought they were already on. Maybe I'm thinking
really?
of another meeting, but I sort of think I could be dreaming. So if I'm dreaming,
I'll check for sure, so you don't have double ones.
Well, this is Lenny. One thing, if you could please get the links fixed, because this is about the second or third time I've not been able to come in on the Zoom linkage, and I've would try 3 or 4. So if we could get the system working, I'd sure appreciate it.
Yes, thank you, Lenny. Sorry about that. I'll check on that as well.
May I make one other suggestion? If you could send out a linkage a day or so before the meeting, it would be helpful, because when the linkage comes out a couple of weeks in advance, it gets stacked up and lost in the inbox. So a linkage a couple of days before the meeting would sure be helpful.
Okay, will do.
Any other comments or suggestions? If not, I want to thank all of you that participated. And as I said before, we're going to make sure that all of this is sent out to you in a link so that you can see the meeting in its entirety. And of course, we all wish you good health and a happy holiday season, a Merry Christmas, a Happy New Year. And we hope that we'll be in a better healthy position in January than we are in December. So that's my wish for you and the goal of the health department.
Yeah, our goal out here in the community.
Thank you all for the excellent work and presentations. As always, you do a great job, and I appreciate the information very much. Happy holidays, everybody.
Happy holidays.
Thanks, everyone. Have a great holiday. Bye-bye.
Thank
Thank
you.
Bye-bye.
you. Happy
Happy
holidays.
holidays. Thank you guys for all your hard work. Super appreciated by the public.